Hi, I'm Monica Lippy. I am a manager with the Santa Cruz County Human Services Department Housing for Health Division. And I've recorded this presentation to provide a high-level overview of our coordinated entry system. My hope is that by the end, you will have a clear understanding of how it works and how it plays a critical role in our community in streamlining access to housing resources and supports and services for people experiencing homelessness. So with that said, I will open my slide deck here and get started. All right, here is Santa Cruz County Housing for Health Partnership definition of coordinated entry, and that it is our approach to coordinate and manage the system's participating housing and service resources. Coordinated entry supports the system in making equitable decisions to best connect people experiencing homelessness interventions to end their homelessness based on available information and resources. And so I bolded and underlined this word available intentionally, and I'll get to that in a few minutes. But before doing that, let's just break down this definition a little further. So coordinated entry, or CE for short, serves to ensure that all persons experiencing homelessness have fair and equitable access to the set of resources and services for which they're eligible, regardless of where they present for assistance, and that resources designed for households with the highest service and housing needs are targeted to those who need them the most. It is also a federal and state mandate for all regional continuum of care, or COCs, to have a coordinated entry system, or CE or CES. And most housing programs that are funded by COCs must only work with people that are referred through a coordinated entry system. Locally, our COC is called the Housing for Health Partnership, and this is staffed by, whoa, sorry about that. Oopsie. The COC Housing for Health Partnership locally is staffed by our division, the Housing for Health Division. And basically what this is it's an entity that is a governing body that's made up of county, cities, community-based organizations, CBO partners that are all working together to address homelessness, and they make decisions around funding and strategic and program plans related to the local allocations that we receive in this county, earmarked or that are designed to support programs that are addressing homelessness. Locally, our COC, the Housing for Health Partnership, approved our current model of coordinated entry in the early part of 2023. So a little bit more than just the definitions here, but wanted to make sure you had that information. So, okay, I think it's important for you all to understand exactly what is meant by housing resources as they relate to coordinated entry. So CE refers people to 3 different types of housing resources, or also known as housing programs. And so in order of intervention intensity, the first type of housing resource is or a housing program is transitional housing. This is the type of housing that provides temporary accommodations, housing accommodations, and supportive services to individuals and households experiencing homelessness. And the goal is to provide interim stability and support to successfully move folks onto permanent housing and to maintain permanent housing. An example of a local transitional housing resource is the Bill Wilson Post Homes Program. I think that might be the only one we currently have. There are more additional PH programs that are in line, that are coming down the line. But for now, Bill Wilson's Host Homes is our one. And it's important to note that transitional housing should not be confused with shelter, emergency shelter, or navigation centers. These types of this type of interim housing shelter is not currently in coordinated entry in our inventory of resources in coordinated entry. However, transitional housing is. And then up next is rapid rehousing, or RRH. Coordinated entry has quite a bit of these types of housing resources. And what they are really are programs that are short-term rental assistance and services designed to help people obtain housing quickly and stay housed. Rapid rehousing programs, they follow a housing first model without preconditions for program entry. And they typically provide assistance, rental and case management assistance for up to 2 years. Some programs are shorter, maybe a year and a half. You don't really see rapid rehousing programs that are they're typically no more than 2 years. And so some examples locally, we've got the CalWorks housing and move-in program, or CHAMP, also known as CHAMP. We've got the Housing and Disability Advocacy Program, or HSAP. So those are just a couple local examples of some rapid rehousing resources we have in our inventory. And then last, we have permanent supportive housing resources. So these are very similar to rapid rehousing in that they combine rental assistance or subsidy with case management, supportive services. However, there's no cap in the length of time that people can be served in PSH programs. They are permanent or for however long the participant needs them. They are typically reserved for the chronically homeless individuals or households. And similar to rapid rehousing, they operate in the housing first model without preconditions for program entry. They move people, case managers can either move people into the private market housing sector, or they or PSH units can be tied to a particular project with that have designated CE units. An example of this is the Vienna Star complex in Live Oak. There's a lot of new affordable housing developments that, when taking government funding for the project, are often required to set aside a certain amount of units specifically to be filled by coordinated entry. These are typically PSH. So now that we've covered these definitions, let's dive into a bit of the history of how CE has evolved, to give you a little bit more context for the development of our current path. All right, so our current, the community's first CE version was called SmartPath. So for those of you not familiar with SmartPath, this was a coordinated entry model developed locally following what many other communities across the country were doing. It involved assessing people using a standardized assessment called the VI for that. The Vulnerability Index Service Prioritization Decision Assistance Tool. And this intention of this assessment was to determine a person's household vulnerability of those that were experiencing homelessness. And it generated a score, which was used to match people to housing program resources. All persons assessed were added to a housing queue. At the time we were calling it the community queue. And then from there, they waited to be referred to a permanent housing resource. So we learned a lot of lessons from SmartPath. First was that our community queue grew incredibly large. We had way more people in the queue than resources available to refer them to. And then over time, the community, it became known as the list to nowhere. The majority of assessors that were doing the VI SPDAT, they just met with people one time to deliver the assessment, and they offered very little light touch assistance. There was a lack of transparency in the process and false expectations provided. There were also a very large number of people doing this work, these assessments. My colleague, Jessica Shiner, and I, we trained over 300 people to be smart path assessors. And this resulted in inconsistent quality of the delivery of assessments, inconsistent messaging. It was difficult to maintain the fidelity of the model, and it provided just an overall, it made for just an overall poor participant and assessor experience, all of these different factors. And then also the referrals resulted in a number of issues. By the time people were referred, if they were referred, they were often unlocatable, or the information gathered was insufficient to properly match and refer them to the resources we had available. And then this resulted in a lot of ineligible referrals. So then there was also the issue that people didn't have the documents they needed to apply for housing, such as identification or disability proof, which is often required for PSH programs. And that process of obtaining those documents often takes a lot of time to acquire. So it really did slow down the housing process once people were referred and enrolled in programs, and added extra layers of responsibility to the program provider, the housing program provider. Okay, sorry about that. All right, so all right. Remember when I was covering the basic definition of CES just a few minutes ago, and that is our approach to connecting people experiencing homelessness with available assistance in the community. I just want to really be clear that despite all the work that we've done to redesign coordinated entry, there is still not enough homeless system housing or enough housing resources in Santa Cruz County for all households experiencing homelessness. Our last point in time count, this is the annual census that we do every January, February, where we canvass the street and document every person that we see that is experiencing homelessness and count the number of people in shelters. This last time, earlier on this year, 2024, revealed we had 1,850 people experiencing homelessness in Santa Cruz County. And this is widely considered an undercount. However, currently we only have enough permanent housing in our system to help roughly 1,000 people at any given time. And furthermore, most of those 1,000 slots are currently filled. So that means that there are very limited openings every month for others that are experiencing homelessness to move in to those slots. Clearly, there's a big discrepancy between the numbers of people that are out there and the numbers of housing unit slots, housing resource slots that we have, and we need more. We've got quite a bit of inventory that is earmarked for families with minor children and the transitional age youth population. So thankfully, those are the 18 to 24-year-olds. Okay. So thankfully, right now, the vast majority of families in TAY that are connected are able to be referred and served by housing programs. However, that's just not the situation we have for our single adult population. We don't have nearly enough housing resources to meet the needs. All right, and so here are just some numbers to help illustrate the issue of an overinflated community queue. In 2022, the final year of Smart Path, 690 new VI FDATs were completed. And out of those that were assessed, only 133 referrals were made to housing programs. So this left 557 people who were assessed that year, but couldn't be assisted due to our limited capacity of housing resources. These 557 individuals went through personal interviews by people that they barely knew often. They were asked really sensitive questions and then told to wait and were left with no further action. And then of the 133 referrals made, only about 5% resulted in actual housing. So it was very clear that Smart Path was failing to meet the needs of the majority of participants. And it just became very evident that we needed to do so much better to help our unhoused neighbors and help those people that can't get that we don't have enough resources to provide. And so we decided, okay, let's just look at this all over again. And we embarked on a 2.5-year, COVID kind of got in the way, made it slow down our progress, redesign effort. And we just totally recalled Smart Path to what it is today, the Housing for Health Partnership Coordinated Entry System. Okay, so now that you understand why we wanted to move away from how we operated CE and under Smart Path, here are some key changes we've made. We've fully redesigned the assessor role, now known in this new model as connectors, no longer assessors, and it fully integrates their involvement and housing problem solving work as the core approach to providing assistance and support to people experiencing homelessness. So housing problem solving is a strategy and a skill that involves providers exploring all potential resources and supports a participant might have outside the system's inventory. It really involves providers or connectors to get to know somebody and talk to them, get to know their situation. How did they become homeless? Where did they come from? What social supports do they have? Or did they have that maybe they can reconnect with? What kind of benefits would they or services would they benefit from? What are they eligible for that I can help them connect to? So there's a lot of different things involved in housing problem solving. It's like a whole other training or many trainings actually, so I can't really go into too much of it here, but in its essence, its core is really building a relationship with somebody and helping them explore what supports and resources that they can help them that are outside of our system's limited resources inventory. And this is built into this new model as its core approach. So some examples, we have connectors that are reconnecting people with loved ones, family members that might be willing to house them. If anyone here has heard of Homeward Bound, in essence, that is a program that utilizes housing problem solving. Basically, we can send anyone anywhere they need to go. They want to go as long as they have a confirmed place, a long-term place stay. So that's really housing problem solving basic here. And then also what else? The VI for that is as part of coordinated entry, terminated in the end of 2022. We created a new custom housing needs assessment, and this is what the connectors are using now. It's a tool to, well, it's sorry, it captures the data that we need about people to determine their prioritization to be referred, matched and referred to housing resources. And it also is a tool that the connectors use to gather the information that they need to have effective problem solving conversations. It really covered the participants' strengths, their barriers, their history. It's a very comprehensive assessment, and none of the questions in it now are not needed to provide problem solving or matching someone to referral to refer them to program. Unlike the VI Spit Act, where the majority of the questions that were asked were just not necessary and they weren't utilized to help somebody. Our goals are to include our goals include improving the facilitation of connection to mainstream and community resources, and streamlining the process for prioritization. And our new version recognizes the limitations of our system's resources, and we use connectors to provide as many people as possible with tailored support, service connections, and problem-solving partnerships. All right, and then here's some more benefits of the new model. Connectors are engaging with their participants much more than in the prior model. They're expected to meet with them weekly, at least once weekly, to work on their goals as they relate to housing. And they work with participants for an average of 3 to 6 months in a case management fashion versus just a one-time shot. So there's more of a stronger relationships between the connectors and the participants, more time to help get them onto a pathway. There's more transparency for participants and service providers about who will be referred to housing programs and what the timeline is, timeframes are. Once the assessment's done, if they're not going to be referred there, the connectors understand that. They're conformed to that, and they can inform their participants. So expectations are better managed here, and there's not false expectations out there as much as there was in the prior model, because there's just a lot more information available to both the connectors and the participants about what they can and can't get out of coordinated entry. Referrals are resulting in much faster move-in because the connectors are really supporting the participants to gather the documents that they need for those move-ins. My favorite benefit of the new model is that the connectors are housing people outside of our limited housing program resources. They're doing tremendous work helping to reconnect people with long loved ones. They're helping people to increase income and their benefits. Sometimes that's all that's needed is just a little bit more, and then they can afford their own place or shared housing. Or sometimes they have a voucher, but they just they don't have that housing navigation knowledge to how to utilize it and find a place. And the connectors are really helping them do that, or they're helping them to apply for project-based voucher housing. And all sorts of things. They're doing a lot of great work that is ultimately leading to people getting permanently housed without having to wait to be referred to a housing program that may not ever materialize. And so, like I mentioned, the prior model, we were only at a 5% success rate. Currently, from September 2023 to September 2024, 23% exited to permanent housing situations. And that's not even including the people that were referred and enrolled into housing programs. This is just the people that didn't get referred that the connectors worked with to make sure or to find alternative solutions for. So this is really, really exciting piece of the new model. And then last, we've got a connector collaborative. This is where the connectors are convening with Housing for Health, where we share any policy updates or information on HMIS, our Homeless Management Information System. We invite various presenters from the community to come do technical assistance and provide presentations on various topics that help them in the work that they do and helping people experience homelessness. It's just a great way for Housing for Health also to be informed about what's working for them, what's not, so we can continuously evolve and improve our model. All right, so here is just a really high level process flow chart of how somebody gets through coordinated entry. It starts up here at the top in this initial engagement stage. This is really where the relationship starts, where connectors they complete an initial triage and safety screening and start to work to build a rapport that they need with their participants to get a relationship going. And then all of the participants that proceed after that initial stage must be enrolled in coordinated entry program in our HMIS, the Homeless Management Information System. This is what it allows us to report on as required by HUD on all of the operations and outcomes of coordinated entry. And then connectors have referral priority to county funded shelter beds, and they can be referred at this stage or later if beds become available at a different time, but oftentimes it's early on. And then the next step after this is that the participant does a housing needs assessment, or we often call it an H&A. And this assessment, it covers 8 domains of a household experience. It covers the housing, that covers housing composition, household composition, their housing history, their income and benefits, social support, legal and documentation issues. It covers health information. And then there's there's section on some additional nuanced eligibility questions, as well as a section that the connectors can document their own observations. The rest of the H&A is self-reported data by the participant, and then there's that one section that is the connector's observation. And then this H&A, it's important that you guys know that this could take many times, many sittings, many different meetings. It does not necessarily happen in one shot. It often requires the relationship and rapport to be strong with the participant and the connector, really to get solid information and complete this assessment. So it can take a little bit of time. Then once it's completed, the H&A generates a score in HMIS. We're now using a threshold scoring system to determine who moves on to the housing queue. So not unlike last Smart Path, where everyone completed the assessment, they went on the queue. Now it's only people that score who get a specific score after completing their H&A. So really what this is a threshold score. It establishes a cutoff point, and participants scoring above the threshold are added to the queue, the housing queue. And those people in the queue are waiting to be referred to housing programs that are part of the when this happens, the Housing for Health staff monitoring on the back end will notify connectors if their participant has been placed on the queue, and then this is when they really dive into like, okay, let's get all of the documents we need to make sure that moving into housing will be quick. Those that fall below the threshold score, it doesn't mean that that's over for them, that their coordinated injury journey continues by continuing to work with the connector with doing housing problem solving work to achieve their self-identified housing stability goals. The threshold score is established based on the amount of resources expected to be available, housing resources and connector capacity resources. And it's dynamic. And so this means that this is going to shift over time based on those anticipated resources, the availability of them. Also it's important that you know that score is going to change or differ by population because our housing resource availability for certain specific populations vary. Just like I mentioned earlier, we've got quite a bit for families and pay. So currently right now for families, pay, and veterans, there is not a score required to get on their queue because we have a sufficient amount of resources that are designated to work with those populations that they don't need a score. Everyone at some point can get referred to those programs. And again, like I mentioned earlier, that's just not the case for our single adult population, who right now, currently as of October 2024, need to have a score of 16 or above. That is our cutoff, our threshold score at this time. So then after the H&A, and regardless of whether scores result in housing placement, housing queue, connectors will work with participants on a housing action plan, or we call them PAPs. And what this is a plan that includes between 2 to 5 areas that the participants identify in the H&A that they indicate they would like some support from their connectors working on. And we set this up in an HMIS so that when they're doing the H&A, they identify those issues and those things that they would like help from their connector, those automatically feed into the app. This tool includes both the participant strengths, their goals, and then also the steps that both parties, the connector and the participant, will take to help them move forward to achieve their goals and onto a pathway to housing. And then going back to those that have been placed on the housing queue because they scored above the threshold again, these households are then matched and referred to available openings based on the following factors in this order. First, the household must meet eligibility criteria for the program. Then they must meet project preferences if they're required through funding agreements. Then, so for example, they're like certain projects only work in certain locations of the town, geographic targeting. And then third, the household must have all of their documents. At least that is where we're trying to go. We have not fully implemented this piece to it yet, but that is what we're trying to do, is make sure that by the time they are referred, the people that have the documents for that have been helped by their connectors to get their documents, they're all ready to go. Those will be referred first. And then if those 3 criteria, so they meet the program eligibility and they meet the project requirements based on funding and contracts in place, and then they also have their documents ready. Then if these 3 criteria are met, the folks that have been on the queue the longest will be referred first, and then if needed, scores will be used as a tiebreaker. So basically, once they're on the queue, the score really doesn't matter unless they're there are others with the same score, then it's the length of time that they've been on it. Those people will be referred before if they're tied, but, sorry if I'm, oh gosh, I'm messing up here. What I'm trying to say is that, the sport, once somebody's on the queue, is the sport isn't all that relevant anymore because everybody on that queue will have an opportunity and chance to be referred to a housing program. It depends on when that happens. It varies person to person based on the factors that I mentioned here. And then the last stage in the flow is then housing is secured, either through a housing program, if the participant is referred, and then if the person is referred through a program, they help them to secure housing, or by the help of a housing health partnership connector, helping them to identify an alternative housing solution. All right, so the next slide, I am not starting all over again here, guys. Okay, the next slide here is another visual of how people move through coordinated entry access and the process. In case the last one wasn't so great for you, I'll try to walk through this a little bit quicker. On the left side, you can see that people can access connectors at various points. We've got connectors working out of shelters, medical clinics, within various community agencies, through straight outreach, or they can access by calling 211 or going on their website and completing a connection services request form to be referred to a connector. And I'll talk about that in a minute. Then the next is step is then participants are enrolled in coordinated entry, and they can be connected to shelter at this stage, or again in any other stage, but often in the beginning. They work on a housing needs assessment, they work on a housing action plan all along the while they're doing housing problem solving work with their connectors. If their score, their H&A score results in the participant not being prioritized for the housing queue, they will continue working with their connector on housing problem solving, ultimately leading them onto a pathway to housing or securing permanent housing. Then, but if they are prioritized for the queue because it's scored above the threshold, H4H will let the connector know so that they start supporting the participant, obtain their documents, move into housing again while problem solving conversations continue. And ultimately from there, if their housing situation hasn't resolved by the time their time is up to be referred from the queue, they are referred and then are matched to programs and then referred to them, and enrolled in the housing program, and then ultimately end at the same stage in permanent. So that's just another visual here. Okay, so this chart shows all of our current access points for CE. At the time of this presentation was recorded in October 2024. So please keep in mind that we are continuously onboarding new connectors, so this chart will change over time. But this is our list currently. And if you'd like to check out our website, housingforhealthpartnership.org, you can see what our current access points are at that given time whenever after you watch this recording. So you can see from this chart that what type of access point each agency is, what populations they serve, and their availability as far as who they work with. So some folks, connectors, only work with people that their agencies are already working with in different programs, internal clients. Others take referrals. And let's see, at the time of this recording, we have currently 38 active connectors. Meaning right now at this moment, 38 providers with enrolled cases and coordinated entry connector providers. We've trained many more than this. And some of those trained connectors are still working out internal processes so that they can start taking on this work. And then we also have another new cohort of 28 new connectors coming online next week. So we're growing, and it's a fluid situation. So this chart here, by the time you watch this recording, may be changed, and it will continue to grow. So, like I mentioned, some take their own clients and some take referrals, which leads me to my next slide. And ta-da, 2-on-1, and Housing for Health have a new partnership that I want to share with you. We're collaborating to provide dedicated resource and service referral connection assistance to people experiencing homelessness or that are at imminent risk of becoming homeless. And it's just a very exciting new connection point we're providing with this partnership, virtual, over the phone access for participants to get in line to receive coordinated entry services. So as part of this new project, the 2-on-1 team they are connecting callers and resource seekers with available shelter, affordable housing unit, opening information and available shelter information. They are, and just loads of other resources to support our participants, our callers, our resource seekers that are seeking housing information, housing assistance. And then also the 2-on-1 program provides connection support by they are tracking connectors availability and making referrals to those connectors that take referrals. To access this, the callers, the participants, all they need to do is call 2-on-1 or go on the website and complete this form called the Requesting Connection Services form. And then from there, 2-on-1 will refer resource seekers to connectors that have availability, or they will add people to their wait list until availability opens up. So it's really important to note that an immediate connector referral from 2-on-1 is not yet possible, given that we don't have enough connectors that take referrals yet. There is a wait list that 2-on-1 manages, but everyone that completes this form or directly contacts 2-on-1 will, at minimum, receive resource suggestions that are tailored to their own individual needs. So that is our new access point I wanted to share with you. And then, oh, that's it. This concludes my presentation. I hope you found that it was informative, and I hope you stay tuned for future webinars or recorded presentations related to CE. In the meantime, I invite you to check out our website, housingforhealthpartnership.org, to dive further into coordinated entry and other H4HP initiatives. If you have any questions or would like to schedule a meeting to discuss coordinated entry, please don't hesitate to call or email me. Here's my contact information. Also, if you have any interest in providing connector services and becoming a connector, and you work with an agency in Santa Cruz County that serves people experiencing homelessness, please reach out and we can schedule some time to meet and explore whether your position and your agency is a good fit for coordinated entry. And that's it. Thank you for taking the time to listen today about coordinated entry, and I hope you have a lovely day. Stay warm and be well. Thank you.